What I am going to do is, I am going to conduct a 15 minutes workshop on a subject which is of utmost importance to all of us, and that is preventing heart attack among doctors. Preventing doctors among doctors. What I am going to do is, I am going to come back with certain parameters what have changed in the last 5 years, first of all. And then I'll come back to certain guidelines for preventing heart attack among doctors. One, there has been a change in the level of fasting sugar. When we were studying, it used to be 140 fasting. When we were in medical college, they used to say 140 fasting sugar is normal. एक ऊपर जाएगा ऊपर हाँ ऑडिटोरियम में एक ही 140 fasting sugar is normal. Fasting sugar is normal. Now it came to 110. Then it came to 100. Then it came to 100. And now they are talking about making it 90. That the sugar should be lower than 90. So there is a change in the guidelines of fasting sugar. There has been a change in the guidelines of cholesterol. Total cholesterol, when we were studying, 160 was taken as normal LDL. Then it became 130. Then they said 100. Now they are talking about 70. That for Indians, LDL should be lower than 70. There has been a change in triglycerides. When we were studying up to 400, we never used to bother. Then it becomes 200. Then it becomes 160. Now they are talking about 125. When we were studying, blood pressure 100 plus age was normal. Blood pressure 100 plus age was normal. It has changed. It became 140. Now it has become 120/80. Now it has become 120/80. Now it has become 119/79. Even 120/80 is considered high. It is lower than 120. That means 119 and 79. When we were studying in thyroid, to diagnose hypothyroidism, a TSH of up to 10 was taken as normal. Then it came 5. Now it has become 3. The new guideline says 0.3 to 3 is normal. That means if it is more than 3, it's abnormal. Now you can see the whole spectrum is changing. Now why this is important for us to know? Because if a patient comes to you and he has a mediclaim, he got his mediclaim done 10 years back when his blood pressure was 140/80. At that time he was a non-hypertensive. Today he is hypertensive. And you will write down, he will say, मेरा blood pressure तो 140/80 10 साल से है. You will write down hypertensive, pre-hypertensive for the last 10 years. और उसका claim रुक जाएगा. So you need to know the definitions when they changed. If a person comes back to say and say, 15 साल से मेरा TSH 10 है, 5 है. आज आप उसको बोलोगे कि सब क्लिनिकल हाइपोथायराइडिज्म है. उस टाइम पे आप नहीं बोलते. इंश्योरेंस कंपनी वाला बोलेगा आपने जो है इंफॉर्मेशन को कंसील किया है. So we must know that parameters are changing. We must know that parameters are changing for everything. The parameters are changing for everything. Okay, they are practically changed for HDL, LDL, total cholesterol, sugar, blood pressure. Now, SGOT, SGPT, normal is less than 40. In the next 2 years, you will find new guidelines. They are now recommended it, but they have not yet adopted it, that a normal SGOT, SGPT will be 25. If it is 26, it will be considered high. It will be 27, it will be considered high. अब ये जो सारी guidelines change हो रही हैं, as a family doctor, as a family physician, how do we अंडरस्टैंड दिस कॉन्सेप्ट. अगले साल फिर चेंज हो जाएंगी. हर साल आप इसको याद करते रहोगे. सो after going through the literature, I have created a term called investigation velocity. I have created a term called investigation velocity. This term I have taken from PSA velocity. Because there is a term called PSA velocity. PSA velocity is rise in PSA, average rise in PSA in 1 year. So, if the PSA is 1, next year is 1.1, next year is 1.2, 1.3, and the PSA velocity is 0.1 rise every year. The velocity is 0.1. This is called velocity. Now this velocity concept can be taken in everything. Every investigation. For example, if a person's fasting sugar is 60, and if you see last 10 years, 60, 65, 70, 75, 80, 82, 84, 85. If these are the sugars for the last 5 years, and then make a graph, and you will know when he will cross 110, when he is going to become diabetic. If there is a progressive rise in velocity of each investigation, you can predict that this patient is going to become diabetic, say 5 years from now. Then, even if it is 85, lower than 90, you are still going to call him as a pre-diabetic. If a person's LDL cholesterol was 60, it became 62, 64, 65, 70, 75. And if it is rising every year, you know, you can have a graph and know when it is going to cross 100. So you know that he is in a dyslipidemia state even if the value is normal today. If you have a patient with SGOT of 20, and if you see that he is rising every year, 21, 22, 23, 24, 25, 26, and today is 35, and if you have those values, you know that he is in a subclinical hepatic dysfunction. So please stop telling the patients, तुम्हारी reports normal है. अब लोग पेशेंट फोन करता है ना कि डॉक्टर साहब शुगर कितना है, अरे बढ़िया नॉर्मल है. There is nothing like normal. You must ask him पहले कितनी थी. जब तक आप पिछली रिपोर्ट से कंपेयर नहीं करोगे, you cannot call a report as normal. You cannot call a report. This concept is called a velocity concept, which is a new concept. I narrated devoted to the year 2009. Use this in the year 2010, and you will find you will be able to pick up a lot of patients. Lot of patients. Now, if a patient has come to you whose SGOT, SGPT is rising for the last 10 years, and if he has not taken precautions, he can't blame you at the last moment and saying, "Aapne mera ilaj theek nahi kiya." If you have been telling him, "Log sharab peete hain, log sharab peete hain, कहते हैं मेरा liver normal है." जब तक वो कहते हैं मेरा SGOT 40 क्रॉस नहीं करेगा, मैं शराब पीऊंगा. Wrong. Follow SGOT every year. And if you find the SGOT is 20, 21, 22, 23, 24, 25, 30, he is getting liver damage is occurring. Why are we waiting it to up that it has to cross 40? और वो शराब पी रहा है, बोला डॉक्टर साहब ने बोल दिया तुम्हारा नॉर्मल है, शराब पी लो. So this concept we need to understand and start implementing it in our clinical practice. Therefore, it is very important to see older records. Nobody will mind if you go to a lawyer. His first consultation fees is very high. एक वकील केस कॉन्फ्रेंस का पैसा अपीयरेंस से ज्यादा लेता है. वो कहेगा मेरा अपीयरेंस के चार्जेस 11,000 रुपए हैं, लेकिन पहले केस कॉन्फ्रेंस का पैसा मेरा 25,000 रुपए की मेरी फीस है. All of you sitting here, your first consultation fees should be higher. Subsequent fees can be lower. Because in the first consultation fees, you are supposed to see old